Welcome again to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry, straight from the experts. And I'm Jon, and every week I'm chatting to Dr. Clifford Yudelman from OptiSmile, taking a deep dive into the world of dental care from a consumer's perspective. Whether you're looking to brighten your smile or protect your wallet, we've got you covered with practical advice and the latest insights. So stick around as we uncover the secrets to maintaining both your dental health and your finances. New week, new topic. Dr. Yudelman, welcome back.
Thank you. And I got a lot of great feedback last week from some listeners regarding the ice chewing and also the nail biting and the lip biting episodes helped a few people, so I'm very happy. And lately a lot of people have been asking me about mouth taping and nasal breathing, so I decided to do an episode which I call Mouth Taping and Nasal Breathing, Myths, Evidence and Safe Practice. So I wanted to debunk a few things and give my own opinion on some of this.
All right, so let's get right into it. This is going to be very, very interesting. I want to ask you, Dr. Yudelman, what clinical studies have been done on mouth taping for snoring or mild sleep disordered breathing, and what do they actually show?
Well, that's a great question because, these days everything's heading towards evidence-based medicine. When I try to look it up, there's only a handful of very small trials, meaning fewer than 20 participants. And it did report roughly a 30% drop in snoring when a type of micropore tape is used every night. But it was based largely on bed partner logs, like did your wife complain about your snoring or did your husband complain about your snoring? But they didn't include full what's called polysomnography, which is a hospital sleep study. We did a few episodes on sleep apnea and we spoke about sleep studies. So this episode overlaps with that. Sleep study will track the effects. And also, you wouldn't be able to do such a big study with polysomnography to do a hospital sleep study where they hook up a lot of wires to you and they check all kinds of things. Is very expensive. It's about 16,000 Rand to spend a night in the hospital. So it would have to be in a big university setting or something. They could do it with a home sleep study, which basically we send a lot of patients for a home sleep study, which I'll just recap on here. I know we did the episode, but that's where you wear a pulse oximeter on your finger and you've got a little sensor or tube that sits under your nose and a little iPhone, like the size of an iPhone 4, little gadget that straps around your chest that measures when you're trying to breathe. It measures your snoring, it measures your oxygen, and it checks everything, what's called the AHI or oxygen, your apnea hypopnea index. But you could do a study with some home sleep study kit. And in this case, there's no studies that I could find that were like that. Another app that I find very useful that you could possibly use for a study that I use myself, it's called Snore Lab. And I tried some mouth taping. I'll tell you about it a bit later. But I tried mouth taping with Snore Lab, and I'll as I say, I'll try to remember to add that in a bit later. The studies that they've done didn't have all of that and was just bed partners. So we can't confirm whether any benefits last or if it applies to deeper sleep disordered breathing or sleep apnea. It's still intriguing, but it's unproven, and it's maybe a quick fix for mild, very mild snorers. And I know we've got further questions, so I might have answered about 4 of them right there. Let's see what else you got for me.
But doctor, why is the research still so limited?
Well, because mouth taping is a low-cost DIY hack with no major sponsor, so there's little incentive or funding to support large studies. Anytime someone does a large or expensive study, it's for a cancer drug that's going to cost millions and make hundreds of millions, or for a machine, or for some kind of gadget or drug or device. And the cost of the study would have to outweigh the sales, or vice versa. You'd have to be able to sell a lot of tape. But yeah, you can use any over-the-counter micro-pore tape. There is a company that makes something called Myo tape that I've tried. We'll maybe chat about that just now. But a well-designed trial would randomize several hundred participants into like genuine taping. I don't know, sham taping. I don't know how you would do that. And then compare it to standard CPAP and also to an oral device, which is proven. CPAP and oral devices are proven, and we speak about that in our previous episode. And then use full polysomnography or full hospital sleep studies to measure the AHI, the oxygen desaturation, the sleep staging, which you don't get with a home sleep study. That's where you have sensors on your brain, on your scalp, and around your eyes to check for REM sleep and other sensors. And also, you'd have to check it against the reported outcomes. And, proper blinding, adherence tracking, several months of follow-up would be essential to truly determine the safety and the efficacy, and also something called placebo effects, which is a very strong one in this case. So, yeah, I know that was a long answer, but I think it's a very important subject. Because as we'll get into later, I think it's important for people to know what evidence-based means, and we're here busting myths and not only saving your money and saving your teeth, but this now starts getting into a saving your health situation.
Ultimately saving your life.
Yes.
Powerful stuff.
Yes. No, definitely. Yeah.
Yeah.
Go and listen to the sleep apnea and snoring episodes for sure.
Yeah, definitely. But I mean, Dr. Yudelman, which persistent online myths about mouth taping actually drive you insane? And how does the evidence debunk those?
Yeah, look, it's crazy. There's some very popular podcasters. I won't mention them by names. There's one in particular that everybody loves, and I'd hate to mention his name because people will start emailing me and saying, "How can you say that about?" And never mind, I didn't mention his name. But let's just say maybe when I'm not on TikTok a lot, but every time I go on TikTok, I see some other myth about mouth taping curing sleep apnea. It's also, you get ads for mouth taping and things like that on Facebook, maybe because I've Googled it before. But, instead of curing sleep apnea, it can in fact worsen true apnea by blocking oral airflow. Because for some people, that's the only place that they've got the air to come in, because their airway is being blocked through their nasal passages from the way the airway blocks up when they're getting apneas. There are these claims that it reshapes your jawline or detoxes your lungs. That's complete and utter nonsense. Passive lip closure exerts very negligible force on your bone, and there's no mechanism to clear lung toxins. Influencers love these before and after stories, but there's simply no scientific basis for these bold claims. It's absolute nonsense.
Got to be careful with the TikTok. I myself have opened it many, many times, and there's a lot of stuff on there that's complete nonsense. But some people don't know that. They take it as the truth, and that's where it gets very dangerous. But Dr. Yudelman, who should absolutely avoid taping, and why?
Anyone with significant nasal obstruction, like a deviated septum. There's something called nasal polyps, or chronic rhinitis, which is chronic, basically stuffy nose or blocked nose or allergies, should steer clear as they rely on oral airflow. People with moderate to severe obstructive sleep apnea, or I would say even to the top end of mild. We speak about AHI and how this obstructive sleep apnea is classified to do with your AHI. Habitual mouth breathers, people that just are used to breathing through their mouth, because if you seal the lips, it can cause like a dangerous hypoxia or drop in your blood oxygen. And obviously those that are prone to claustrophobia or panic responses might find the sensation intolerable. Mouth taping would be unsafe for them too. The Myo tape, if you're going to try it, it's very expensive. I think you got to buy like about 90 of them for 500 Rand on Takealot. It is quite it's a clever invention. It's sort of like physio tape. It's got a gap in the middle. It goes over your upper lip, your lower lip, and then on either side of your mouth. And you can still drink water or talk or force your mouth open to breathe. But as soon as you relax or you fall asleep, it keeps your lips together. So, I think you can get a sample pack if you want to try it. And, if it works for you, I would use SnoreLab to listen in on to record your snoring and to see if it actually does help with any mild snoring. But if you've got severe snoring, you definitely want to get a home sleep study and listen to our podcast about sleep apnea and so on.
We should actually include a link in the podcast description of that app. What's it? SnoreLab.
Yes.
Is it a free app?
Yes, it's on.
Is it a free app?
It's a free app, but like any app, you only get a partial recording, or it will only record every third night, and then you got to pay if you want to get a full recording. It's worth. I think you can cancel anytime, so it's worth actually just doing the paid one and recording. There's settings. You got to go into the settings and then set it to record in low. You don't need high resolution, but at least in the beginning to record any loud sounds, and then you can actually go back and listen to, like, are you coughing? Are you actually snoring? Are you choking? You can actually hear what's going on. It's amazing how.
It's quite scary. It's quite funny listening back to those recordings in the morning.
It's scary. It sounds like someone's choking you.
Wow.
I sleep with a CPAP machine, and I've got mandibular advancement devices that I wear myself. I like my CPAP, even though I do make advancement devices for patients, and they much prefer them over CPAP. The CPAP is a continuous positive airway pressure, or actually these days the proper name is APAP, which is automatic instead of continuous. It's automated, but we're getting a bit technical here. The app I think is very handy.
Okay, so definitely include a link for that for both Android and Apple. Dr. Yudelman, yes. What are the key physiological effects or benefits, rather, of nasal breathing that underlie the mouth taping rationale?
So there is some good rationale behind it. So I did read a lot about this. I listened to a lot of audiobooks, and I might have mentioned a book before, Oxygen Advantage, and in this case there was a second book called The Breathing Cure, and there's a book that I think has started a lot of this by a guy, James Nest, I think his name's James, called Breathe or Breath, and it's making a big comeback. The book's already getting quite old, but nasal breathing when you're awake, I'm 100%, I've been doing a lot of nasal breathing, which doesn't require lip taping because you're actually awake. There's not much point taping your lips when you're awake because, you can just keep your lips together and actively breathe through your nose, which I highly recommend. It humidifies, it filters the air, it reduces airway irritation. And a big one that everyone's talking about is it generates nitric oxide, not nitrous oxide, which is laughing gas. Unfortunately, it's the nitric oxide, which actually dilates your blood vessels in your lungs. It boosts oxygen uptake, and you retain a modest level of carbon dioxide, which optimizes your hemoglobin, which is the stuff in your red blood cells. It optimizes the ability to offload oxygen to your tissues, and you get a deeper oxygenation, sharper mental focus. This is something that, that are all the benefits that people talk about with lip taping. If only that was all proved with science. But another thing is, they say sharper mental focus when you wake up and enhanced immune defense. There's a lot of claims for this, but no real proof. But definitely doing that during the day. If you're stressed, you breathe. There's something called box breathing. You can Google it, or just simply taking about 6 breaths a minute, because a lot of people get hyped up and they breathe much faster. So if you on my Samsung watch, and I'm sure on the Apple, it's got a breathing exercise. and you set it where you breathe in slowly for a count of 4 and then out for a count of 6. So that's 10 seconds per breath. And you can even slow it down more than that. But 10 seconds per breath is basically 6 per minute. And if you do that through your nose, you will actually find within a few minutes that your heart rate drops. This is all due to the nitric oxide and the effects of breathing through your nose. So it is a wonderful thing to do, and I'm pleased that we're touching on it on the same episode. But this doesn't really, I'm not relating it back to taping your lips at night without proper proof.
Do you look funny when you're taped at night? Would your partner laugh? Does it look like you've been kidnapped or something?
100%. It's really, I've tried years ago when I first got diagnosed with sleep apnea, and I was trying different CPAP masks. You've got these nasal masks that are kind of small and they just fit over the tip of your nose like a clown mask, and they're a lot less cumbersome and more comfortable. And I was wearing that for a while, and then I started getting something called mouth leak, where the air was going in my nose and out my mouth, and you wake up with a very dry mouth. So for a while, I tried the micropore. The Myo tape wasn't available, and the micropore is that white tape, and you've got to get the low stick one. So when you peel it off, you don't take half your lip off with it. Don't go and use duct tape or hostage tape or something. And
imagine.
And I must say the white micropore across your lips does look funny. For me, it's uncomfortable. You feel claustrophobic, whereas the Myo tape, even though it's expensive, it's a very clever, and it doesn't stick. It sticks well enough to your skin, but it doesn't hurt when you peel it off.
Yeah,
and it's kind of springy. And I like, if I get up in the middle of the night, I like to have a sip of water. If you go to the bathroom, or you've taped your mouth and then you want to say goodnight to your wife or your husband, but your mouth is taped together. At least with Myo tape, you can still speak, or maybe just stick some on your wife or your husband as well, and you can have his and hers. I think it comes in pink and blue as well.
Gosh.
Nice colors.
Okay, well, this is very interesting. I also want to ask you, what types of tape or commercial seal strips are safe and effective, and which one can maybe cause skin or respiratory problems?
So stick to the medical grade micropore. Ask at the pharmacy which one won't peel your lip off when you take it off. Some of those things are very sticky. They need to be hypoallergenic, latex free. There are those like silicone strips, I think mainly in the States and online. So a lot of these TikToks and all these things is to sell fancy sticky tape, basically. Don't use duct tape. It's too sticky. Don't use any kind of household tape. They'll cause tears in your skin and they'll leave residue. I don't recommend that. But don't go for something on the first thing you see on TikTok, because you're just paying a fortune for something that's not even proven.
What skin and respiratory risks should listeners watch out for, Dr. Yudelman, and how can they actually minimize them?
Yeah, so because we're mainly talking about mouth taping and maybe people that are already doing it, we already touched on things like you look for redness, contact dermatitis from the adhesives, painful micro tears or micro scarring. You don't want to reuse the strips. Respiratory risks, if your nose congests overnight, you might feel okay when you go to sleep. But what happens if during the night your nose gets stuffy? You could become breathless or have low oxygen levels. If you're an older person that already has sleep apnea, maybe you got heart problems. You wake up and you wake up dead. You don't want to wake up dead.
Jeez.
If you wake up dead and your wife calls the ambulance and they come and your mouth has got duct tape over it, it's going to look like a crime scene.
That's very That's very graphic there. I can see that so clearly. Oh my word. Okay, that's not a good look for you.
If your husband's asleep and you put duct tape over his mouth, make sure you put it over his nose, and I promise you tomorrow night there won't be any snoring.
Oh my goodness.
Yeah.
You're funny.
We shouldn't joke about that.
Yeah, but you're funny.
Maybe leave it in. It is funny, but don't do that. Don't do that. If you're listening, don't do what I just said. Use a fresh piece of tape or a new piece of tape every night. Keep a scissors handy to pull or cut it off. And keep a note if you wake up with headaches or skin reactions. I don't think you'll keep it up too long if you're noticing that. I'm sure you've got a couple more questions, so I'll stop there.
Okay, and Dr. Yudelman, is there any way you can self-test your breathing, your nasal breathing function before you actually try the tape?
Yeah, so first try, lip seal test. Sit with your lips gently closed for 2 minutes. If you're breathing comfortably, your nasal airway is likely okay. Next, pinch each nostril in turn while breathing. And if you've got a full blockage on one side, you might need an ENT, ear, nose, and throat doctor evaluation instead of tape. You might have a polyp or some other issue. And finally, after exhaling normally, hold your breath and time how long the urge is to inhale. If you can breathe out and then hold your breath, and you can only do that for 10 seconds, that's in the book Oxygen Advantage, that's called the BOLT score. That's a very low score. People with asthma or with breathing problems can't do that. But if it's up to 20 or 30 seconds, now we're not talking about taking a big in breath and holding your breath. You can do that maybe for a minute or two, but it's after breathing out, you pinch your nostrils and time yourself. You want to make sure that you've got a good CO2 tolerance. So I actually highly recommend the book Oxygen Advantage. I did 4 or 5 one-on-one sessions with a certified trainer afterwards, but I'm not a medical expert, and I didn't want to get too much into that. But this overlaps, with it, and I just recommend listening to those books rather than watching TikTok.
Good advice there, Doc. And I also want to ask you, what step-by-step protocol do you recommend for a safe at-home mouth taping trial, like skin prep and application?
If you are going to try it, do what I said above. Just prep, clean and dry your lips. If you shave, make sure that there's no or if you've got a moustache, maybe it would have to be a bit shorter. I don't think you want to stick very strong tape over a moustache. If your skin's very sensitive, you can put a little bit of a barrier cream. You make sure you select a micro pore, as I mentioned, or some specialty strip. The Myo tape is the best known one. It's sort of a medically proven or medically tested one for hypoallergenic and all of that. And we mentioned it a few times already. If you're using something like a micro pore, you put it in the center, you close your lips and you push gently from the middle towards the corners, and then do a trial test for 20 or 30 minutes, have a nap or early bedtime. I'd keep a scissors just in case you can't grab it. You may need to cut it off. Maybe just do one test where you put it on and then see if you can peel it off. Scissors might be, I don't know about using a scissors right next to your mouth without a mirror. By then you're already suffocating. And then, have a good look in bright light, look in the mirror and just check that you're not irritating your skin. And I'd say after doing some of those tests and following what I just said, then you could extend it to a full night.
Okay, sounds good. And then just lastly, Dr. Yudelman, apart from what we said, waking up dead, what warning signs should you look out
don't
for?
Wake up dead, yeah.
What warning signs mean it's time to stop taping and seek professional evaluation? What would those warning signs be?
Just to go back a second, I know it sounds funny about waking up dead, but there is something that is caused by severe sleep apnea, and it's called sudden nocturnal death. And it is a thing where you hear so and so just died in his sleep. Maybe no previous heart attacks, no previous anything, and it's often in people that have got moderate or severe sleep apnea, and they choking on the back of their throat or choking on their tongue, and they may be on sleeping tablets, or they've had too much to drink, and or the wife doesn't nudge them, hit them with the elbow in the ribs or roll them over, and you literally just have a heart attack in your sleep, and you wake up dead, basically. So it's not as funny as it sounds. It is a terrible thing, and it's common. Wow. Sudden nocturnal death. Nocturnal meaning nighttime, or basically dying in your sleep. So it's worth listening to the sleep apnea episode. I think we must put a link to it here, because anyone that's interested in mouth taping should know more about snoring and sleep apnea. The warning signs, I would say stop immediately if you wake up with a headache, or if you normally have headaches and you wake up and your headache's worse, the stuff's not working. If you're very tired during the day, I think if you panic or you're gasping for air, you're going to take it off anyway. Yeah, if you keep getting skin irritation and you keep doing it, it's only going to get worse and worse. And I'd keep a diary just to track in case you're not sure if it's working or not. Definitely go and see either a sleep physician or an ENT. Just watch out for any ENTs that start immediately recommending that you get your tonsils out or do surgery, because it's unrelated in many cases to sleep apnea. It's more to do with the position of your jaw and your tongue, and CPAP and mandibular advancement devices are proven for these. Unless you have very hectic surgery, maxillofacial surgery, which can be done in some cases. It's very drastic. And there's a trend now, there's a lot of dentists, especially overseas, getting into dental sleep medicine and recommending all kinds of very severe orthodontic type treatment, 2 or 3 years of orthodontics and surgery, etc., to help prevent snoring and airway problems. And personally, I find that very drastic when a CPAP machine or a mandibular advancement device which is proven, not might, will definitely help, even in moderate or severe sleep apnea. A properly fitting CPAP will basically reverse it. So, yeah, I think don't ignore the problem. Download Snore Lab. You can, by all means, if it's mild, very mild, try it. The taping didn't work for me. I use Snore Lab when I've got my CPAP on and you don't hear a thing all night. I've used Snore Lab with a mandibular advancement device, which will cut your snoring and any sounds down almost completely, or at least by 50 to 80%. And I found on myself the myotape, I was able to snore with my lips taped. So in my case, I have mild, bordering on severe apnea when I don't wear anything, the tape definitely didn't work for me.
Okay. Well, at least you're speaking from experience, Dr. Yudelman, and thank you so much once again. This has been very, very interesting.
No, pleasure. Thank you. And yeah, look, hopefully the episode helps at least one person to not wake up dead.
Yes, geez. Really, really hope so.
Yeah.
Brilliant. Dr. Yudelman.
Save your money, save your life.
Save your life. Yes, exactly. Brilliant. Love it. Dr. Yudelman, thank you so much as always. And we'll chat to you again next week. Also, a big thanks to our listeners for joining us. And remember, while we strive to provide valuable insights with this podcast, it's always best to consult with your own dental professional for advice tailored to your personal health. Remember, we're all different. Don't forget to subscribe for more enlightening discussions to this podcast, and then join us again next time as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth. Goodbye.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.